With spring swings into high gear, it's time to focus on improving your self-care routine and overall well-being. For someone with irritable bowel syndrome and with diarrhea, unfortunately, this may be easier said than done. So joining us now is Dr. Jack Braha and Cecile Rooker. Welcome to the show to both of you.
Thanks for having us.
Thank you.
Okay, well, let's go right into what is IBS-D. Dr. Braha, can you explain that to us?
Sure. Irritable bowel syndrome with diarrhea, IBS-D, is a chronic recurrent disorder where patients describe abdominal pains associated with diarrhea, urgency, the need to run to the bathroom unexpectedly, and it's very common, affecting over 16 million Americans. And what's important for the viewers to know is that there are treatment options out there, and it's important to open up that conversation with your physician. And I'm here with Allergan today working with them to present a well-rounded approach that could be considered, including diet, changes in the way you eat, avoiding trigger foods, the use of over-the-counter remedies, antibiotics. And for folks that are looking to get ahead of their symptoms, a proactive approach, Vyburzi, is available for the treatment of IBS-D, which has been shown to reduce abdominal pain, diarrhea, and that urgency associated with IBS-D. And it's important, as with any of the treatments we discussed, such as with Vyburzi, to look out for any side effects such as abdominal discomfort or nausea. And it's not indicated for folks without a gallbladder. So, the first step is opening up that conversation and speaking with your physician about these treatment options that are available.
Okay, well, Cecile, let's bring you into the conversation. What actually prompted you to see your physician?
So I was actually diagnosed with irritable bowel syndrome rather young, high school, college age, but was told that there was just absolutely nothing that could be done about it. And so for many years, I just sort of self-managed and tried to work through the symptoms myself. My daughter, when she began to show symptoms of irritable bowel syndrome, I realized that we really needed to revisit that conversation with the doctor and try to educate ourselves and figure out how to take control of IBS so that it didn't control our lives.
And how actually do you manage this condition on a daily basis?
So the management of IBS is different for every person, I have found, and so my daughter and I have very different triggers, different things that help us manage our symptoms. So there's a lot of things that can help diet and exercise, avoiding those triggers that might bring on an episode of IBS, and also just working with the doctor on the right therapies that might be available.
And Dr. Braha, tell us, if somebody wants to learn more about IBS-D, where can they go to learn that?
Sure. To get ahead of symptoms, folks can go to vyburzi.com and ifgg.org.
All right, well, a special thanks to Vyburzi for sponsoring this segment.